Assalamualaikum and a very good evening to the people that are watching this video right now. We are from Fort Lima Group D5 will be presenting about health issues related to the urinary systems. Today's agenda will be common problems and symptoms, diseases and disorders, factors or causes, and the last agenda will be treatment. The presenters will be Danish Aizat, or you can call him Hakam, Bienvinda, or you can call her Bien, Natalie, and Marwan, which is myself. Let me introduce you what is urinary systems. Urinary system plays an important role in homeostasis. The urinary system is made up of kidneys, ureters, bladder, and urethra. The function is to excrete nitrogenous compound waste such as urea, as well as regulate the volume of body fluids, blood osmotic pressure, ion concentration in body fluids, electrolyte content, and blood pH level. There are few common problems in urinary system such as kidney stones. Kidney stones are hard masses that are made up of uric acid, calcium oxalate, or crystalline calcium phosphate that are easily reduce the production of urine. So the second common problem is incontinence. Incontinence is the severity ranges from occasionally leaking urine when you cough or sneeze to having an urge to urinate that is so sudden and strong that you don't get to a toilet in time. There are other common problem. There are other common problem which is kidney infections, enlarged prostate, bladder infections, and retention. So the symptoms of these common problems are usually burning sensation when passing urine, pain in your abdomen, pelvis, or back, passing urine much more frequently than usual, feeling an urge to urinate but being unable to, or only passing a few drops, and the last one is a physical or mental impairment that keeps you from making it to the toilet in time. For example, if you have severe arthritis, you may not be able to unbutton your pants quickly enough to urinate.
This is the next topic, disease and disorders. The explanation is the kidneys play such vital roles in eliminating waste and toxins and maintaining body-wide hemostasis that disorders of the kidneys may be life-threatening. The gradual loss of normal kidney function commonly occurs with a number of disorders, including diabetes, mellitus, and high blood pressure. Other disorders of the kidneys are caused by faulty genes that are inherited. Loss of kidney functions may eventually progress to kidney failure. So this is the type of disease and disorders. The first one is diabetic nephropathy, and the second one is polycystic kidney disease, and the last one is kidney failure. So for the number one, diabetic nephropathy is a progressive kidney disease caused by damage to the capillaries in the glomeruli of the kidneys due to long-standing diabetes mellitus. What is diabetes mellitus? A disease that prevents your body from properly using the energy from the food you eat. So as you can see in this diagram, there's a two types. So the first type is the pancreas failure to produce insulin, and the second type is the insulin receptor cells fail to respond to insulin properly. And this is the diagram for diabetic nephropathy. You can see from here. So, the second one, polycystic kidney disease. It is a genetic disorder in which multiple abnormal cysts develop and grow in the kidneys. As you can see in this diagram, it is the kidney that are riddled with cysts from PKD. You can see it's very many cysts that grow in the kidneys, which is pretty disgusting. So, in people who inherit PKD, disease may start to form at any point in life from infancy through adulthood. Typically, both kidneys are affected. So, there is no cure for this disease. The only way to save the patient is to do a kidney transplantation. Yes, kidney transplantation. I'm sorry. Yeah, and the last one is kidney failure. So both diabetic nephropathy and PKD may lead to kidney failure or renal. It is classified as end-stage kidney disease, which is the kidneys are no longer able to adequately filter metabolic wastes from the blood. So, if the kidney function drops below the level needed to sustain life, then the only treatment option is kidney transplantation or some means of artificial filtration of the blood, such as hemodialysis. What is hemodialysis? It is a medical procedure in which blood is filtered externally through a machine. So you can see in this diagram how hemodialysis works. So the blood is filtered, excrete everything such as toxin, wastes, and then they pump back the blood into the patient. So that's all for me. I'm giving to the next topic.
So let's go to factors and causes. There is a lot of factors in common problems, also diseases and disorders in urinary system. The main and most common factors are from genetic, diabetes, dehydration, and trauma or injury. As for genetic, people can get these diseases from gene-led families that have been passed down or from birth defects. For diabetes, it can harm the kidneys by causing damage to blood vessels inside your kidneys. The filtering units of the kidney are filled with tiny blood vessels. Over time, high sugar levels in the blood can cause these vessels to become narrow and clog. For dehydration, becoming dehydrated can lead to bladder irritation, and concentrated urine. Not having enough fluid in your body will lead to concentrated urine, which can irritate the bladder and make you feel the urge to pass urine with urgency or more frequently, or suffer from incontinence. And lastly, trauma or injury. Trauma can cause your kidney injured. These injuries can be happen as a result of blunt trauma or penetrating trauma. So that's all from me. Thank you.
Hello guys, I will talk about treatment. So, there are many ways to treat urinary system disorder, diseases and problems, but the main treatments are antibiotic to treat infection. So, chemotherapy. Chemotherapy is a drug treatment, uses powerful chemicals to kill fast-growing cells in body and is often used to treat cancer. Next, kidney transplant is a surgical procedure. Transfer healthy kidney from healthy person into someone who's have kidney failure. And then next we have medication to relax the bladder. Okay, that's all. I hope you guys understand. Okay, that's all from us. Hope you will understand and learn so many from this. Thank you. Have a great day ahead. Bye bye.